To apply a cervical collar, we must first prepare the patient by explaining the procedure to them as well as asking them to not move their head and neck. We want to place them in a supine, neutral position, slightly elevating their head with a towel. Then we want to select an appropriately sized collar, which can be measured from the chin to the suprasternal notch. Then we'll apply the collar. Have another paramedic stabilize the head to prevent any movement during the procedure. The Velcro strap will be placed underneath the neck, and there should be a gap underneath the neck as the head is elevated. Then wrap the collar around and join the Velcro strips with the C-spine not cleared label located on the front. The chin should sit slightly in the groove shown on the photo on the right, and the collar can be slightly loosened if it becomes too uncomfortable for the patient. In general care, immobilization facilitates the neutral alignment of the spinal cord to reduce forces placed upon it. A supine position for the patient is ideal. However, if that's not possible, then the most comfortable position for the patient would be appropriate. Patients should not be transported to hospital on the combi carrier or a hard spinal board. Extrication should be carefully planned and clearly communicated, as this minimizes further injury to the patient and risk of manual handling injuries. Ondansetron should be prophylactically provided to reduce the risk of nausea and vomiting, spine movement, and airway compromise. The contraindications include apomorphine, and it presents in 8 milligrams in 4 mils, and it should be given through an IV as a slow injection over at least 30 seconds. For analgesia, IV fentanyl would be preferred as it is less likely to make the patient nauseous. The contraindications include a history of hypersensitivity and late second stage labor. It presents as 100 micrograms in 2 mils, and the dosage is 50 micrograms at 5-minute intervals, consulting after 200 micrograms.
Created using Powtoon.